A couple of years ago, while making rounds at the hospital, I had a lesson in grace. A young female college student was shadowing along, thinking about medicine as a career, and we stopped in to visit with a beautiful, maybe 88-year-old woman. She was not my patient, but a friend who had been close to my mom for years and was recovering from a bout of pneumonia. The wise elder widow shared with us how she had recently developed a sexual friendship with an older, maybe 90-year-old man. How it was different than what it would have been had he been 30-something, but how they had both so enjoyed a caring, caressing, listening, and naked closeness. It happened maybe 4 weeks in a row after enjoying Sunday brunch together, she told us. And then, last week, he suddenly died. I'm so grateful that it could happen. Being with him in that way was absolutely beautiful, she proclaimed. I think the young college student's mouth dropped to the floor. The elder woman's words were not in the least bit remorseful, and instead were a forthright expression of the celebration of his and her life. My elderly friend also died about a month or two later, and I will never forget how she had taken the time to share her intimate and poignant experience. Of course, everything changes as we age. I didn't say goes away, I said changes. In women, vaginas become smaller, stiffer, thinner, and with less automatic vaginal lubrication. Women can be over-concerned about how her looks are changing. In men, penises become smaller, with less ability to have and keep an erection during sexual intercourse. Men can be over-concerned about erectile prowess. In both cases, self-expectation can become a problem. This is a natural course of aging in all men and women. It's not a question of if, it's a question of when. But these changes can happen sooner than expected as a result of medical problems like diabetes, heart and blood vessel disease, smoking experience, excessive alcohol, or as a result of medicines for pain, anxiety, or depression. Certainly, when something isn't working with one's body, that should bring the individual to consider going to the doctor. It should not bring guilt, shame, or feelings of inadequacy, although those fears and feelings alone can be enough to result in sexual dysfunction. Take a lesson in grace from my 88-year-old friend. Sexual function at any age has everything to do with caring, caressing, listening, and closeness, and not so much all that expectation stuff.